What an amazing year it's been so far at Children's of Alabama.
1, 2, 3, tower.
2018 opened with the groundbreaking of our new 12-story parking deck and office building at 1600 4th Avenue South. The building, to be named for James C. Lee III, will be known as the Lee Building. It's steadily on the rise, just like so many of our programs and advances in children's health care. The Burn Center unveiled its newly donated 3D V-Pod sensory pain distraction system. It's a TV monitor with 3D imagery that serves as a positive distraction for reducing stress and anxiety among children undergoing painful procedures. Our family-centered care program continued its mission of including families in the treatment and care for patients. The program improves patient outcomes by strengthening partnerships among departments and medical teams. It's part of our mission for improving the lives of our young patients. Every month throughout the year, our nurses get a standing ovation when the Daisy Award is presented to an outstanding nurse who has shown exemplary care to our patients. The award is based on nominations from parents. Each winner receives a handcrafted award made in Zimbabwe, and cinnamon buns go to the entire department. In May, all of our nurses were recognized for their commitment to pediatric health care. Their efforts went beyond patient care this year, with the giving of more than $2,000 to Ronald McDonald House Charities. Also, 11 of our nurses were cited for Excellence Awards. Way to go, nurses! And special thanks to Chief Nursing Executive Deb Wesley for outstanding leadership. Our communications team had a busy year organizing numerous medical education conferences, including 3 mental health conferences, the Concussion Summit, and the Cancer Symposium. On the state and national stage, we sponsored booths at both the AAP, or American Academy of Pediatrics, and the PAS, or Pediatric Academic Society's conference. The media team also hosted many events related to newsworthy health topics and children's programs. Digital media was extended to include a new podcast series called Inside Pediatrics to expand on articles from our Inside Pediatrics magazine. The podcast features interviews with physicians, researchers, and health professionals, and it's reaching hundreds through our partnership with Radio MD. Way to go, team! Children's was the recipient of numerous awards this year, including Birmingham Magazine's Best Kids Health Facility and Neonatal Intensive Care Unit. Mayfair Medical Group and Over the Mountain Pediatrics were finalists in the Best Kids Health Facility category. Recognized as finalists for Best Physician were Dr. David Glasgow of Greenvale Pediatrics and Dr. Phil Harmon of Pediatrics East. Greenvale Pediatrics, which has 3 locations, won again as Birmingham Parent Magazine's Family Favorites. All 3 Greenvale practices were also chosen as Birmingham Magazine's Best Pediatric Facilities and Pediatricians for Children, all because of their dedicated, caring, and professional physicians and staff. Greenvale Pediatrics was also recognized by the Greater Shelby County Chamber of Commerce as part of their annual Healthcare Professionals of the Year program. Greenvale Brook Highlands' Dr. Jamie O'Drezen was selected as the Healthcare Professional of the Year in the Pediatrics category. Also honored were Dr. Tori Anderson and Darby McKeldry, both of Greenvale Brook Highland, and Dr. Cami Sester of Greenvale Alabaster. Also in the limelight was Vestavia Pediatrics, which earned Best Medical Practice in Vestavia Hills Magazine's 2018 Best Of contest. This practice also treated 32,000 patients each year over the past 2 years. Great job, Vestavia! Children's was honored for the 9th consecutive year by U.S. News & World Report for its ranking among the nation's top children's hospitals. 8 of our specialties were named among the top 50 in the United States. The recognition is a collaborative effort of Children's and the UAB Departments of Pediatrics and Surgery. A top priority this year was the opening of a new service to help children with psychological disorders. The Psychiatric Intake Response Center, known as PIRC, opened in March to help patients, families, and providers navigate resources for mental health care. Licensed mental health workers are on hand to take calls or see children in person to assess and provide the best treatment options. The center is open 7 days a week and serves a 5-county area. Children strengthened its security measures this year with the implementation of a new guest management system. The system includes new regulations for accessing the McWane Building and updated guest registration requirements. We also added safety and crisis intervention courses that employees are required to take. Special thanks to the Security Department under the leadership of Dennis Blass for making safety a priority. Speaking of safety, our patient safety records improved this year as a result of decreased events. Congrats to the entire children's staff and the Solutions to Patient Safety (SPS) team. In addition, Children's was the host site of an SPS South regional meeting where more than 100 attendees came from 14 hospitals throughout the Southeast. Always working to be better, we transitioned from PeopleSoft to N4 this year. N4 is the new time and attendance tracking system that improves our data input and retrieval methods. Kudos go to the Human Resources, Payroll, and Finance departments for their hard work in getting everyone on board with N4. Children's gained statewide attention again this year as the chief beneficiary of proceeds from the Regions Tradition Pro Amateur Golf Tournament held in May. The event kicked off with a media day at Top Golf Birmingham, and some of our patients were at the tournament to meet celebrity golfers and have a fun day with the players. Back in the race for the 8th year was support for the Racing for Children's event held at Barber Motorsports. Event proceeds are used to help find cures for cancer at the Alabama Center for Childhood Cancer and Blood Disorders. Speaking of racing, our patients enjoyed a visit from NASCAR race driver Ryan Reed. Many other guests stopped by during the year, including numerous superheroes and famous mascots Aubie the Tiger from Auburn University and Big Al from the University of Alabama. Miss Alabama contestants, St. Paul and the Broken Bones, the Barons, the Houston Rockets, and the Auburn baseball team all came to visit. Children's hit its own home run when employees attended a night of baseball during our annual family night at Regions Field. Employees and their families enjoyed ballpark food while cheering on the Barons. The event is sponsored by Human Resources in partnership with the Corporate Communications and Marketing Department. This year, we celebrated several anniversaries, including 10 years for the Simulation Center. Physicians to Children's reached 40 years of practice, and the Regional Poison Control Center at Children's marked 60 years of service. Congratulations to the staff at these locations. In July, we were excited to open Children's at Lakeshore. The facility is a partnership between Children's and UAB Rehabilitation Services and the Lakeshore Foundation. It provides clinical, therapeutic, and transitional support care to children with disabilities. From the drawing board to reality was the addition of 2 new beds on our pediatric intensive care unit. We now have 24 beds, allowing for improved care to our critically ill or injured children. Almost completed is a new plaza adjacent to the Louder and McWayne building. This area, which was previously a playground, will be outfitted with seating for patients, staff, and guests so they can enjoy the refreshing outdoors while on campus. We also worked this year to improve our care to endocrine and cancer patients by implementing a new type of radiation treatment called radioiodine thyroid ablation therapy. Congrats, team, for meeting the stringent safety requirements so we can better care for our kids. Even though the year is not over just yet, it's amazing to see all that has been accomplished so far. Congratulations go to all Children's staff and honorees for making 2018 even better for our children.